Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Do you want to avoid surgery? Are you suffering with joint or muscle pain? Do you have arthritis, dull aches, stiff joints, and can't figure out why? Do you feel like you're slowing down and can't walk, run, or play sports the way you did previously? Welcome to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and I'm asking you to stay with us while Dr. Darrow answers these questions and much more today when you call the program at 866-870-5752. We are a resource for information and education about the orthopedic musculoskeletal system of the body. If you call now, you'll receive a copy of Dr. Darrow's latest book for free, Regenerate, Don't Operate. That number again is 866-870-5752. And let's welcome Dr. Darrow. Hi there.
Hey, Nita, how are you today?
I'm great. And yourself?
Living it up.
Yay. Well, that's what we want our listeners to do. So remember, just for a free book, you could call the program and talk directly to Dr. Darrow about your pain that you might be in at 866-870-5752. So don't hesitate. The hour goes by so fast, Dr. Darrow, doesn't it?
It does. And then, unfortunately, everybody who's shy in the beginning calls right at the end.
I know, right?
And then I don't have time to talk to everybody. So, yeah, we would love to hear from you right now. Get the show going. And I love talking to you folks. And it can be issues about pain in your body and the musculoskeletal system. You know, rotator cuff tears, meniscal tears, we get a lot of those. Neck pain, back pain, arthritis in the fingers. I typically, every day, inject all over the body. I know that's kind of wild, but I've been doing this for almost 25 years since my residency at UCLA in physical medicine and rehabilitation, where I was board certified. So I would love to hear from you. If you want to call and talk to me live right now, the phone number is 866-870-5752. I'm going to repeat it for you while you scramble for your pen. It's 866-870-5752. If you're listening and driving, probably the best thing is to pull over to the side of the road so you're safe. Pull off that Bluetooth and talk to us directly so we can hear you. So I think until we get some callers, I'm going to answer some questions because I get questions from my website all day long, all night long. I get emails in the middle of the night from all over the world. And the first thing I do when I wake up in the morning is I answer emails, and between patients, I answer emails. And up until like midnight before I go to sleep, I answer emails.
You are the king of email.
You know, before email, I used to write a lot of letters.
Oh, that's funny.
Even as a kid, I loved communication. I loved getting letters in the mail from my family and friends and all that. Okay, so I'm going to start off with this one. Slap tear pain worse after cortisone. So what's a slap tear? SLAP is an acronym for superior labral anterior posterior. That happens to be in the shoulder, and it's a tear in the mechanism that helps hold the humerus bone, that's the arm bone, into the glenohumeral joint, that's the shoulder joint. And typically, when people have surgery on this, to either remove part of it or stitch it together, it fails. And don't just count on me. You can go to Google slap tear surgery, and you'll find that it's not a great procedure to do. But it's done all the time. Every day there's thousands of them done. And unfortunately, people come to me after it's failed. It's called a failed surgical syndrome. So this person says, I was diagnosed with a right shoulder slap tear about 3 months ago. I received a steroid injection, helped for about 6 weeks, but now it's back and worse than before. I'm interested in PRP and stem cells. Don't want surgery. Cool. Well, that's good. This person's smart. The surgical route, I don't think, is a good one for this. I did study orthopedic surgery in my internship and my residency. I did as much orthopedic surgery as I could. I loved it. It's a lot of fun being in the operating room, the OR. And I didn't find out that these surgeries worked too well. So, it's something that I switched. I actually had a shoulder surgery when I was in my 4th year of medical school, and it failed miserably. Miserably. It made my arm blow up like a balloon full of fluid, and I was stiff, and I never got out of that syndrome. It took a few years until I discovered what we call regenerative medicine. Typically today, it's the use of PRP, which is using platelets from your blood, or using platelets and stem cells from your bone marrow. Taking blood and taking bone marrow are both very simple procedures. When someone's thin, and it is different with someone who's thin and someone who's not thin, when someone's thin, it takes me about 15 seconds to do the bone marrow procedure to get the platelets and the stem cells. If they're a little thicker back there, then it can take longer to find the right spot. But it is an easy procedure to do, and I do them every day at the office. I've been doing them for many, many, many years. I think I've done about, I haven't counted exactly, but about 6,000 bone marrows. And PRP's a lot more than that because I started that earlier. But I've been doing a ton of this. When I go to national meetings, other doctors come up to me and they go, I heard you do all of these procedures every day. How do you do all of them? It's because I've been doing it a long time. I get people from all over the world, all over the country who come in. So I have a great time doing it. And let's get back to this. I'm going to give out the phone number first, then I'm going to get back to the steroid injection.
Okay.
So the phone number to the studio right now, so you can talk to me live. I want your calls. I want to talk to you. You can pretend you're somebody else. You can say you're your brother or your sister or your mother or your grandmother or your friend or whatever. You can make up a fake name. I don't care. I'd just love to hear from you and talk to you.
Do you want
but
to
the
go
number
to,
here?
Oh, go ahead.
No, not yet.
Okay.
The number, yeah, I'll get there in a second.
Okay.
The number to the studio is 866-870-5752. I'm going to repeat it once more. It's 866-870-5752. And Joe, we're going to get to you in just a second, but I wanted to talk about that labral tear and the cortisone shot, the steroid. ONE at the end of a medicine is typically meaning it's a steroid. It could be cortisone, prednisone, dexamethasone. They're all steroids. And testosterone is a steroid too, but it's a different type. Testosterone is anabolic. It makes things grow. But these others are catabolic. They actually break down the tissue. And I had one woman who came in with a tennis elbow who could barely lift her wrist because she had 16 steroid shots in her right extensor tendon for years of playing tennis. And it ate away the entire tendon. It took me quite a long time to rebuild it using regenerative medicine. She got back on the court and did well. So try to stay away from steroid shots if you can help it. Cortisone makes you feel better, like this gentleman who gave me the question, for a while. But it actually is deleterious to the tissue, and he's worse now after that shot. So I wouldn't go for that. I would just regrow that tendon or any other part of the body. It can be cartilage, tendons, ligaments, joint capsule areas, whatever it is. We can help regrow that with simple injections. You walk in the office, you get injected, and you walk out. It's not like a surgery where you can get infections and all kinds of problems and be laid up. So, Joe, you're in Santa Barbara. Your knuckle behind your big toe hurts. Okay, that's real common.
I guess it's the second joint.
Okay.
That's before the, it's that big one that, Because
the
they
big,
kind of
it's the
swell
big
up,
honker.
and then
Yeah.
you can tell it's getting large, and it makes the toe head off
Right,
towards the
right.
left on the
That's
left
what we
foot.
that's what we call the first metatarsal phalangeal joint, if it's what I'm thinking. And when the arthritis gets advanced, we call that a bunion. Correct? That's what you have?
I guess that would be the bunion location.
Okay. So not everybody gets the bunion, which is arthritic hypertrophy, meaning that the bone starts to overgrow. And what happens when there's laxity in a joint, it could be anywhere, any joint, it could be the knee, it could be the hip, we get these osteophytes, which means bone overgrowth. And that's what a bunion actually is. It's from instability in that joint. The instability comes from a poor support of the plantar arch. And what I often do for people with that, if it's not bad, I'll start them off by making them orthotics, which is a little insert into the shoe that helps elevate the arch and take the pressure off of that joint. If it's painful, I'll inject it with either platelets and or stem cells, and that can work very well. I have a gentleman who flies in from Texas, and he had that bone growing. It was sticking up, and it no longer is sticking up, because another thing that happens is it was dissolved away by the white blood cells that are drawn to the area when I do these injections. We actually create some inflammation, and people say, well, why do you want inflammation? It's already inflamed. What we do with these injections of regenerative medicine, platelets and stem cells, is we create with it a lot of things. There's growth factors in it, and the stem cells actually are supposed to morph into tissue. But more than that, there's inflammation, and the inflammation, the short burst of inflammation, brings white blood cells that actually chew up the bad tissue and get rid of it, and they help remodel the bone or whatever tissue it is. So is the problem you're having pain, or is it cosmesis, meaning it looks weird to you?
It's not usually painful, though. If you press on it, you can feel pressure pain.
Okay.
Definitely a larger looking knuckle than on the right foot, and it is definitely causing the left toe to push off a little bit to the left compared to the right foot. Once in a while, I'll step on it, and I'll notice that there will be maybe one sharp pain, but then it goes away immediately. I guess it's indicating, since it's not happening symmetrically on my right foot, that it must be an alignment or supportive problem with the wrong type of shoe or whatever for the left.
Well, it's like I said, you need support under the foot. You need what's called an orthotic. That's the first step. And then the second step at the same time is to start injecting that joint with platelets or stem cells and heal it up. Grow back. You probably, if you got an x-ray, you've already got arthritis in there. Okay?
Yeah, because it's swollen.
Yep. And the swelling, typically after I do the injection, goes away. Okay? I don't put steroids in there. I don't put cortisone in there. I think that's the worst thing you could do, because that makes the joint worse. It feels better for a while, and then it gets worse later. So, Joe, I'm going to go to Mitch now because he's been waiting a while. So God bless you, man, and I'd be happy to talk to you. The number to the office, if you want to call in and get more specific information, Joe, is 800-300-9300. That's 800-300-9300. And if you want to go to the website and watch me doing these procedures, the website is www.lastemcells.com, www.lastemcells.com. Every page on my website has a spot where you can email me, and I promise you I will email you back the same day, or if it's late, I'll get back to you the next day, okay? So, Mitch, I understand your knee bothers you. This is Dr. Marc Darrow, and I do regenerative medicine. I've been doing it for almost 25 years, and I treat knees every single day of the week. I would say probably, Mitch, that I do more knees than anything else, although I do everything else too. So how long has your knee bothered you for?
Well, I've had meniscus tears in both knees, and both times I had outpatient meniscus surgery. But
yes,
now currently my my knee, I have 2 tears according to an MRI, one lateral and one medial meniscus.
Okay.
And at one point, it had locked up on me pretty badly to the point where I couldn't really bend it.
Sure.
And I have chosen not to do any more surgery because I can live with it.
Yeah. Okay.
I try to stay active. I try to go to the gym. I do yoga whenever possible, but I still find it gives me pain once in a while, and I'm unable to bend it completely, like sitting with my knees folded. Okay.
May I speak a little bit? Can I tell you a few things? No, I'm sorry too. It's hard to when you're not face to face to take the cues of who's talking when. I apologize for that. But I have a lot of information for you. Number one, when there is a house, the most important part of the house is the foundation, okay? And if there's damage to a foundation, which can happen in a lot of ways, the earth can shift and the whole house could actually come down. So that's a big problem. You've got to shore up the foundation to have a stable house. When you had those surgeries on your knees, the foundation of your knees were attacked, okay? That's the meniscus. That's the middle part of the knee. It's a cushion for the cartilage that's on the bone. The bones have a covering. Like if you made a fist and put your other hand over it, the fist would be the bone, and the other hand is the cartilage on top of it. And the meniscus is between those bones, between the cartilage and the bones. And when you have a meniscal operation, most likely a piece of the meniscus is removed, and then the foundation of the house is gone. So you're very smart, in my book, not to have another surgery because you're heading toward a knee replacement. Okay, the first ones didn't work. The first surgeries didn't work. Sure, they worked from a surgical point of view because they removed something there that they thought was a problem. I treat people with meniscal tears all day long, and we get most of them better. Well, they didn't have their meniscus removed. They don't have surgery. And I do take care of tons of people also who have had failed meniscal surgeries because we grow that tissue back. I don't know why the orthopedic surgeons, who I love dearly, they do the hardest work in medicine. I'm not putting them down. I'm just confused why they don't read their own journals. Okay, journals are research studies put together in books that come out every month. Okay, there's orthopedic journals. Why they don't read their own research, which shows that we can grow back the tissue, that we can help people with meniscal tears in their knees or rotator cuff tears in their shoulders or arthritis. There's tons of studies on this. I've got a book in my hands right now that I'm showing to the camera with 256 studies, okay? 264 studies of how this stuff works. And then I hear my patients every single day who have been to an orthopedic surgeon say, the surgeon says what you do will not help me. I don't get it. So my advice, I'm not your doctor, my advice to the general public is before you get a surgery, see someone who does regenerative medicine and not a chiropractor, okay? Someone who's an MD who does this all day long. I always tell my patients when I refer them to someone for anything, heart disease, cancer, it doesn't matter what it is. I say, go to the guy who does the most of this. I'm going to send you to somebody who I either know or have read about who does the most of these procedures that you're looking for. Don't go to someone who hangs a shingle after a weekend workshop. And there's a lot of guys in regenerative medicine that do that. And this is for all of you listening. If you go to a doctor, the first thing you say is, how many of these do you treat every day? How many did you treat yesterday? How many did you treat the day before? You don't have to be shy with doctors anymore. You are allowed to bring in pages of questions, and my patients do it. I tell them to. Bring in all your questions. I want to calm your mind. And when I spend time with a new patient, or any patient, follow-ups, before they walk out the door after I talk to them for a while, I say, do you have any more questions? I want all your questions. And if you don't have them all now, email me. Every one of my patients gets a card with my email address and my cell phone on it. I want to communicate. I want my patients to know what's going on. When I get a patient who comes in and says, you decide, Dr. Darrow, you tell me what to do, I go, I'm not going to ever do that with any patient. I'll educate you, and then you decide. Do you know why I do that, Mitch?
No.
Because I don't want someone poking their finger in my face saying, you said. I can help you and I can guide you. Sure, go ahead.
I just wanted to ask you, this is my last question.
No, you can have as many questions as you want. I love it.
I appreciate it. So you've talked a lot about PRP injections versus stem cells. When you have a patient, and I know you don't know my particular case, but when you have a patient who has a two torn meniscus in one knee, is there one treatment that you would, without seeing the patient, is there one treatment that you would recommend versus the other?
Yes. And this only has to go with the efficacy, meaning the value and the usefulness of regenerative medicine. And I tell people the story like this. I like to use basic common sense. If you have a hole in your backyard that your dog dug real deep, and he's been digging there for years, would you rather have a guy with one shovel or two guys with the shovel to fill it up quick?
Yeah.
Do you get the analogy? If you do blood, you're going to get platelets. If you do bone marrow, you're going to get platelets and stem cells at the same time. So with a post-surgical knee, I would recommend that you do the best treatment, the most efficacious treatment, which is using the bone marrow rather than just the blood for platelets. Although, if people say, well, I'd rather do platelets, then I go, fine, because at least you're starting to fill that hole up. And if it doesn't get you what you want, you can do another treatment, and then the next time you can do bone marrow, stem cells, and platelets.
Is the bone marrow, you said, because I'm a bigger guy, not fat, but just bigger build. Is that sort of procedure, you said it's a little tougher with bigger. Is it a painful procedure?
Generally it's not, because I use a shot of lidocaine to put down to the pelvis where I take the bone marrow from.
Okay.
And that being said, I'm just going to be honest with you. There's some people that walk into my office moaning already without anything. Yeah. And there's some people that, they don't have an issue with getting an injection. And some people, I actually had one of the top pitchers from the Yankees and his wife fly in from New York to see me. And he was sitting on the table, and I examined him, and I said, okay, I'm going to inject you. And he goes, inject me? And I go, that's what I do. And he goes, I don't want any injections. I hate injections. I'm going to go get surgery. And he left the office. Now, little did he know that with the surgery, he's going to be getting plenty of injections.
Right.
But that's, everybody's got their own mindset about getting injections. And all I do all day long is inject. So I inject myself. I don't know if you know my story, but it started with my wrist. I injured my wrist, and that was injected. The next day, 50% better. I injected it myself a few more times. I don't even remember wrist pain anymore, but it was so bad I could barely pick up a pencil. And then I did my shoulder, and that one was amazing. Because it's kind of a funny story. I was lying in bed with my wife watching TV, and I pulled out a syringe. Hang with us there, Mitch, and I'll finish up my story and get more information from you. God bless you, man.
Stay with us, Mitch.
Thanks for your call.
Stay with us, and you're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.